Okay, so for today we're going to be doing the Glasgow coma scale to rate our patient's level of consciousness. To accomplish this, we're going to use 4 steps. The first step is going to be to check on the patient, and in this case what we mean by that is we're going to check the medical record. I'm also going to check to see if there's anything that would impede our ability to test either his eyes, his verbal or his ability to speak, or his motor responses to things. This would include his eyes being swollen shut, ventilation through his mouth, or paralysis. All of that could impede upon our ability. Also hearing, if he can't hear, that would also be a big problem. So that would be my first step, is to check. Now the second part here would be to observe. So as I walk in the room, I want to try to just observe my patient without actually making a lot of noise or anything like that. And I'm just looking to see if they respond. So if they see me, or excuse me, hear me walk in the room, and they see me, I'm looking at their eyes to see whether or not they turn to me. So in this case, Michael here is not turning around and he's not looking at me. So I can say pretty confidently that we're not seeing any spontaneity in terms of his eye opening. So the next step would be to stimulate him using kind of a louder noise. So in this case, hi, hello, hi, Michael. So in this case, his eyes did open and they did lock on me as I said his name. So in this case, he would be rated at a 3 with the spontaneous eye opening being a 4. Now, if he didn't respond with his eyes when I called his name and that sort of thing, then the next move I would go to is a small pinch of increasing pressure over 10 seconds to see if I can get him to elicit a response to pain, and see if his eyes open at that point. And if that didn't work, then he would have no reaction and he would score a 1. So the pain would score a 2 in this case. So for him, in this case, he scored a 3 on this part. So for the next part, we're going to go to verbal. So now I'm going to ask him a question. So Michael, hi, can you tell me your name and can you tell me your birthday?
Mahatma Gandhi ate too much.
Okay, so he said Mahatma Gandhi ate too much. Now, I asked the question, name and birthday. Now, he did give me a name. It's not his. And he gave me that he ate too much. So I could pretty confidently say that was an inappropriate response to my question. So he would score a 3 on this. Now, a 5 would be if he answered the question appropriately and correctly. A 4 would be if he was confused and he answered correctly in the respect of he gave me a name and birthday, but it wasn't his. 3 we've just addressed is an inappropriate response. 4 would be a 2 would be incomprehensible. So that would be if he just kind of muttered, moaned, anything like that. And then a 1 would be if he gave me no response or no reaction at all. What we're going to be doing next is testing his motor capability. Now, to test his motor capability, what I'm going to do is I'm going to ask him to perform a command. So in this case, I'm going to command him to perform an activity. In this case, it's going to look like this. I'm going to be right here. Hi, Michael, can you go ahead and reach out and grab my finger and squeeze it? There we go. So he was able to reach out and grab and squeeze my finger. So that's going to be rated as a 6 on his motor capability. Now, if he was not able to do that, my next move would be to introduce a stimulus to the head or neck. In this case, I'm going to go to the trapezius, and I'm going to squeeze gently, and I would start just kind of soft and then build the pressure over the course of 10 seconds, increasing. What I'm looking for is to see if he's going to reach with his arm to kind of reach towards that area. So in this case, if he brought his hand up and reach above his clavicle to come get my hand and kind of swat it away, that would tell me he's localizing to pain. Now, if I did that same thing and I squeezed, increased pressure, and he did a quick kind of flex and swat, but didn't get it above the clavicle, that would tell me that he's able to withdraw to the pain quickly, but he's not able to get to me. Now, the next level, it would be if I squeezed and held, and he had a very slow flexion, kind of towards midline, real slow elbow movement. That would be an abnormal flexion response to this. Another response is if I squeeze and he goes and he extends his arm away, that would be an abnormal extension response. And then the final rating would be if I squeeze and no reaction happened at all. Now, if no reaction happened at all, I can also try other places. I can squeeze on the fingertip right here, so I can pinch increasing pressure. I can also put pressure through the supraorbital notch here and increase pressure as I go there as well to test other locations to make sure it's not just a sensory thing. Overall, in this case, he responded to loud noises, so he scored a 3 on the ISO part of this test. On the verbal, he scored a 3 because he had an inappropriate response to my question. And then he scored a 6 on the final part. So he scored a 12 out of 15 in this case.